Jamie Peddle here again. I'm here to talk about autism. As you're all aware of, the changes for the autism program never happened, where the Ford government had lied, and people are going crazy here again in the province of Ontario. And there's a lot of answers and questions that need to be done, and there's nothing being done about it. Uh, you know, the reason why we're in the situation we are in today is because of the bad leadership that we've had in the autism community, which doesn't represent us at all. I'd like to talk about a few things here. On October the 30th, 2019, the Government of Ontario issued the report of its Autism Advisory Panel. This panel was set up by the government in the spring as a result of the uproar and fiasco created with the proposed changes to the Ontario Autism Program. The government appointed 20 people to the panel who are supposed to be leaders, representatives and members of the autism community and experts in the field. The panel was given a mandate to provide recommendations to the government on the design of a needs-based, sustainable autism treatment program that would serve as many kids with autism children and youth as possible within the $600 million budget that the government says they're willing to spend. Many parents like me made submissions to the government and the panel during the spring and summer while the consultations were going on to say a couple of things. Number one, that ABA treatment for autism is evidence-based and medically necessary. For kids who are diagnosed with autism, it is the only treatment that the medical community knows of which may help kids with autism develop their full potential. Number two, the ABA treatment program should be provided by the Ministry of Health and covered by the Ontario Health Insurance Plan. That's OHIP. Number three, the current administration of the OAP under the Ministry of Social Services does not make sense, and it should be transferred over to the Ministry of Health and covered by Medicare, where more appropriate belongs and could benefit from additional federal funding from the Canada Health Transfer and the Health Accords that are negotiated. You know, I have been paying for my son's treatment with my credit card. That's wrong. My son should be able to access treatment using his health card. So what did the panel report say about this? In the full 64 pages of the report, nothing. Not a word. In one part of the report, they addressed the Ministry of Health, but the whole section deals with other mental health disorders and the increased risk of the co-occurring mental health disorder. In one paragraph at page 43, under the heading What We Heard, they wrote this: many of the consultation submissions suggested that treatment for children and youth on the autism spectrum be funded and delivered by the Ministry of Health and not the Ministry of Community Social Service, to ensure that all people with disabilities have access to medically necessary therapies they need to thrive and achieve their full potential across their lifespan, without discrimination based on age or diagnosis. What does this paragraph mean? Does it refer to ABA and the OAP? No. Does it refer to OHIP coverage? No. There's no mention of Medicare. You know, let's talk about autism on the federal government scene here. You know, it's been well over 20 years that autism has been brought forward to the federal government scene here. We know about the Otten case back in 2000. We know about the Pay Now or Pay Later report back in 2006. 2007, there was a Bill C-304 that calling on the federal government to fund autism medically. 2016, the Federal Liberal Party, they had a national convention which over 2,200 delegates overwhelmingly voted in favor to fund autism medically. And yet this panel, this expert panel, says what we heard. You know, this is why we are in the situation we are in today, is because we've had poor leadership who does not represent the autism community very well. You know? So besides now